Hi, Esty. So we are here with Tatiana, and she is the educator for Hale and Hush, and she's located here in not Miami, Florida. Weston,
In Weston.
Weston, Florida. First, let's get to know you before we get into like Hale and Hush. And today we're going to talk about like a lot about oncology clients and just taking that on as a specific niche. So, if you don't mind first sharing, I guess your background as an esthetician, how long have you been an esthetician? What do you specialize in? Well, let's take it from there first.
First, thank you for having me
Of
here.
course.
I have been an esthetician for 11 years. This is my second career. I'm an interior designer. I have a background in interior design. I have a bachelor's degree from the Illinois Institute of Art in Chicago. And when I moved here, I always, laugh and joke around that I got a middle-age crisis. And I said, okay, this is it. I really want to do what I love, and is skincare. So when I was in school, I decided that I wanted to help people with cancer. So I specialize in sensitive skin and cancer patients and anybody with any autoimmune disease.
So, you've been working with like cancer clients or anyone with autoimmune disease from the beginning.
From the beginning. I got my first certification in oncology when I was still in school.
Oh, wow.
Yeah.
And like, how did you see the need for that? Because usually people don't really see like the need off the bat of like, obviously when you choose a niche, sometimes you're choosing a specific clientele that you want to help. So like, what inspired that?
The fact that when I was in school, the teacher always said, you can do this, but not on cancer patients. And you can do that, but not on cancer patients. So I was like, okay, wait, hold on. We're like, an industry that we have the opportunity to help, to touch the client. So it's like, no, it has to be more than that. That's why I started, doing my research, and I said, no, I really want to help people. I mean, if I have the ability to touch, I do believe in the healing touch.
Yeah.
I have also a background in Reiki, and my mom and my sister, they both, do it. So I'm like, no, it has to be more. So that's why when I decided to really, wanted to go, I knew from the beginning that it wasn't going to be easy. 11 years ago, nobody knew about this.
Yeah.
So that's why I said, I really want to help. I want to make a difference. And if I can do it in one person, that's it.
Yeah.
I'm happy.
And what are the type of like skin struggles, skin conditions that people with autoimmune diseases struggle with, or even cancer clients?
Well, your skin barrier is compromised. I mean, you can see that the lack of water, it's of course, one of the big things that they go through. It's very reactive. They don't really, I mean, like you can put something super gentle, but they are still gonna react. You can see different things going on under your skin that they could, let's say, like maybe they have a breakout like acne, but it's not really an acne breakout. So you really need to know, how to distinguish that. But that is based on their autoimmune disease.
I feel like also too sometimes there was a time in my life where I would get facials and then like I would get a chemical peel and I was fine. And then there was a time where like I was on a specific medication too and
Oh,
I got a
yes.
chemical peel and it was very light and my whole face was tomato red which was what not like common for me. So I feel like also too you can kind of tell like, oh, something's going on. Like we talked a little bit about it earlier with your health, like maybe you're experiencing histamine overload, things like that.
Yes.
So I'm sure you're also able to tell something deeper is going on based on how the skin reacts as well.
That's why it's so important, the intake form. Like that is, when you sit down with the client and you start all the intake form, you can tell based on their medication and the treatment they are going through. If we're talking about cancer patients,
Yeah.
to see what the treatment they are having in that moment. So you can see that, certain things that you can see in the skin, it's because a reaction or a side effect of the chemo or any medication that they are taking or, anything like that.
So if a client is coming to you and they are undergoing chemotherapy or they have cancer, what's the experience like working from you from like the very beginning?
At the beginning, I was a little bit scared. Okay, I am the type of person that I need to know everything before I can start touching the person. So even though I had then, because I guess you're familiar with Cleveland Clinic.
No.
Okay, Cleveland Clinic is a very big hospital here in Florida, but it comes from Cleveland, Ohio. And I started from the beginning of my career. I started working with them.
Okay.
First as a volunteer with the wigs, and then I asked the doctor in charge of the Department of Oncology back then to have that I wanted to help oncology clients and to give me just a room, and I will go there and I will bring my products, and that was it. So when I saw the first client there, I was like, oh my goodness, what am I gonna do? But based on my training, I kind of knew what to do and how to do it. You need to make the person know that it's a safe space. First of all, if you can do the poker face, that you cannot say, or you can, they're gonna tell you everything and they're gonna show you everything. So you need to be able to just have a face that like saying, like telling them, you're safe here. It's okay. Nothing that you're gonna show me is gonna surprise me or is gonna make me uncomfortable or anything like that. So it is very rewarding once they leave. Then you break down. And then you start crying. But in that specific moment when you're with the client, it is, I mean, you have the energy, because some people think that they won't be able to do it. And you can. It's just you get this force like inside of you and the willingness to help them that you can definitely go like nothing, like any other client. So for me, it has been very, very rewarding.
Yeah, I kind of wonder, like, sometimes after work, I do buccal massage. So if I work on, like, I can't do more than 4. 4 is, like, a lot for me. 3 is, like, good. But there was a time where I was doing 4 to 5, and it was getting, like, too much. And then I noticed I was getting pain. Like, I was getting jaw pain. I was not feeling good. Sometimes I was a little bit more emotional. So I feel like sometimes you kind of, like, pick up to what your client has. And I like wonder when it comes to like treating oncology patients, like, I mean, I feel like it can be two things. Like, you're doing community service in a way, like you're giving, so that's opening your heart, and also too, that's like, that helps you as a person. Like they say that raises your vibration because you are giving. But then also too, what is it? I mean, I guess, can you speak to that? Like, when you go home, like, do you have any practices that you do where you kind of like cleanse yourself?
I do. I also carry some crystals in my in my pocket. I cover myself in light before touching anybody, just to make sure that I won't get anything, but at the same time that I won't give them anything. So that's the way I do it. And after I finish my client, I wash my hands with salt and water. So I'm thinking, that I'm removing all the energies that are not mine, that, they don't belong to me, and just going through the drain and making it, transmutation for something more positive. So that's basically what I do. And I clean the space also with essential oils. But you need to be careful, because if the next client that comes in, it's also an oncology client, they can be sensitive to the smell. So it's very important to know also, what to use, because they can be sensitive. If they're in chemo, they're the most sensitive to the smell.
So what are the most common misconceptions estheticians have about working with clients undergoing or recovering from cancer treatment?
That they cannot help them. That's what I was talking about before. It's like, okay, they have cancer, so I won't be able to touch them, or I don't want. If you have been trained, you can definitely, in a safely way, help the client. And you need to know that less is more. They just come they come to you just to feel normal. And that's what I always hear at the end of my facials is like, thank you for making me feel normal. So that's the only thing. If you know what you're doing, go ahead and do it. If you don't, just go ask, do your research. But yeah, you definitely can.
And what's the difference in your approach? So like if you have someone that, is not like completely healthy, not undergoing cancer treatment or
Mm-hmm.
recovering from it, and your approach to someone who does, like as far as like the treatment you do in the treatment room and the skincare that they're taking home.
The difference is in the ingredients and the products you will be using. For somebody that is going through chemotherapy or radiation, you need to use very soothing ingredients.
Okay.
For somebody that is working more, regular client that is working on hyperpigmentation, because you can see it also on cancer patients. They come to you and they say, I have so much hyperpigmentation, but that is because of the medication they are taking. I want to work on this. It's like, okay, we will, but not now. And the other person, regular with no cancer history, then you can definitely use a little bit more aggressive ingredients or actives, I should say. With cancer patients, you don't.
And what are your favorite ingredients to use?
Anything that has ceramides, fatty acids, something very soothing, things like that. I love oils, plant butter, like shea butter or anything like that. I love it for my clients.
And I'm assuming a lot of what you do, I mean, you said that you do more like holistic facials. So a lot of it is like geared towards like nervous system regulation, things like that. Are there any like practices that you include in the treatment that really help?
I do include the Reiki. I do include the Reiki. And I also took another certification for pressure points, actually two. But the first one was thinking of these clients that they come, because you need to know when you can treat the skin and when you can't. Like if the client is, with fever, or maybe has an infection, or you see that the skin is definitely like you cannot touch it because it's raw or anything like that, then I use pressure points or I do my Reiki.
Okay. I love Reiki. I'm a Reiki master.
Oh, really?
Yeah.
Well, there you go.
I haven't done it in a really long time, but I remember getting a lot of cancer patients as well, and it just calms them.
Yes.
Yeah, and brings them like they feel better and they feel more relaxed.
And it's in you. So I bet any client that you treat, they can feel it.
It's funny. One of my Reiki teacher, the second time, because I had 2 certifications, she told me, this was before I became an esthetician, and she was like, she was analyzing how we give Reiki because she could see, and she was like, you don't have to move. Like, she's like, you can stay at the head and you don't have to move and go and I was like, oh, that's weird. And she's like, yeah, that's like, I don't know, like a little bit of your gift. And now that I'm an esthetician, I'm like, oh yeah, I can just stay here and work on their face. And
totally.
So I totally believe in that for sure.
Yeah.
Yeah.
Yes.
Okay. What are some clear boundaries estheticians should maintain in terms of scope of practice?
As I was telling you before, the client will come to you and they start telling you like everything. Okay. We need to remember that we are there only to help them with side effects of the chemo or radiation or any of the medication they're taking, just to heal the skin or help them, with anything that is going on. I never say heal because we are not, healers, you know what I mean?
Yeah.
But when they start telling you stories, we should listen, but not give any advice. That's why I love so much Cleveland Clinic, because we had a very big support team. So if I saw a client that was really having a hard time with emotions, I always direct them, to the social worker or the psychologist. Yes, anybody like that. But we should keep our boundaries with that. Not give any nutritional advice. Don't tell them like, oh, really? You're taking that medication? Or, any of the supplements.
Yeah.
Nothing. We just keep ourselves all the comments and we just focus in the skin.
it seems like it's a little bit more of like a thinner line with the type of clients that you work with, but I feel like it should also apply in general to
Yes.
like
Yes.
just
The same thing.
normal clients, because a lot of
Mhm.
estheticians do that too, but it's like you have no idea someone's like health history, their background and stuff like that. So we have to like proceed with caution, I think, all the time.
All the time,
Mhm.
and especially with them.
Yeah.
But yes, what you're saying, it's totally true. I mean, it's the same thing. Boundaries is the same thing with clients with cancer or, just the regulars. We just should stick to what we know.
Stick to your scope of practice.
Exactly. That's it. We're not therapists, nothing. We're not doctors. We're not dermatologists. We don't, say anything or diagnose anything.
Yeah,
So
for sure.
same thing with them. Yes.
So how did you discover Hale and Hush? Was it like right when you got your certification, or was it a little bit later on? And what do you love about their products?
Okay. I met Chris 11 years ago, right after my certification. It was one of the lines that my certification recommended. So I started with Technique back then. Now it's Hale and Hush. So I started working with Hale and Hush because I love the results that I can see. Not only, I mean, definitely, I always had it for like a lifesaver pretty much in my back bar for cancer clients or for regular clients. And when I became an educator like 2 years ago, I was, also using Hale and Hush most of the time. What I love about Hale and Hush is all the ingredients. They are amazing. We are free of negatives. So, I don't work with any product that has fragrance or any synthetics or anything like that. We're free of negatives, as we know, as you know. We also have a lot of active ingredients that they're gentle to the skin, but you can see results. So that's what I like the most from Hale and Hush. We're also vegan. Some of them are vegan, but only top of my head, probably like only 3 or 4 they're not vegan, but most of them are vegan. All the line is gluten free. So right now a lot of people are having reactions to the gluten. So we're gluten free. We are Bunny certified. So we are not tested on animals or anything like that. I have 2 dogs and 2 cats, so it's very important for me that's and the support you get from Hale and Hush. I mean, even before I was an educator, every time when I saw Chris in a show, she was amazing, helping me with whatever question that I had. And she's the type of person that she answers the phone herself and helps the esthetician.
Yeah,
so
she's very hands-on.
Very, very. And that's something that I love, and I'm grateful for that.
I want to talk a little bit, I don't know if you can answer this, it's okay if you can't, about endocrine disruptors. Like if you know anything about that, like, because it's something that I've been wanting to learn more about in skincare. So like because I have PCOS. So I'm like I'm like, oh my gosh, I know I'm using certain ingredients that maybe I shouldn't be using. And so I kind of want to clean out my routine and make sure I'm not using, like you said, the fragrances. I know that there can be like hundreds of hidden things in just fragrance alone, right?
Yes.
So can you just speak a little bit to that, if you know anything about it?
Well, I do know. I know the terminology is what, sometimes it confuses me because of the language barrier. But yeah, you need to see exactly like the ingredients. Actually, on Saturday, I was with the ST also that is working with me. And we were seeing ingredients on one sunblock. And they had so many ingredients and so many that we know they are not good.
Yeah.
So, we think that the less ingredients will be better. If you cannot pronounce it, it's like no good at all. But anything like no, any alcohol, we should avoid it.
Okay. Yeah, I because I've been thinking a lot lately, like, sometimes I feel like we don't use things when we have, for example, an issue like an autoimmune disease or cancer, so we will refrain from using it. But like, I think that a lot of what we use is also causing issues.
For sure. Yes, for sure.
Yeah.
That is, I mean, I'm 100% sure for that. That's why I really look into the ingredients. If I don't know the ingredient, I Google it. and I see, side effects of it, and it's funny, but you can find so many that are really, bad for you.
Yeah.
So
do your research then.
I do. I
Yeah.
have an app.
What's it called? Is it the Yuka
No,
app?
it's drug something. I have it from many years before,
Mm-hmm.
and it tells when I put the, all the medications, it shows you the side effects. It shows you what it is for, if any ingredient, exactly what it is. If it's a medication, it tells you also side effects and everything. So that's something that I do, and I also have a dictionary of ingredients in my treatment room.
That's very useful.
Yeah.
I'm trying to, I kind of created a study guide for myself to study like ingredients and stuff.
It's funny because I think in this generation, I mean, you're of course much, much younger than me. Same thing as the Esty that I'm working with right now. And she's pretty good with ingredients. So I asked her, I said, where did you learn so much about ingredients? And she said, well, I wanted to be cosmetic.
A cosmetic, like a chemist?
Yes, exactly. So from the beginning, I have always been into the ingredients, and I'm like, oh, okay, now I understand. Because it is crazy to keep up with all the new ingredients that are coming out and everything. And you know what? When I don't know something, I say to my client, okay, let me do my research. And then I do the research and look into all the ingredients of, whatever product they are using, if they are not using my products. But that is the safest way to do it.
Yeah, you kind of learn as you go a bit too. Yeah.
Yes,
for sure.
But it's impossible to learn every single ingredient.
So are all Hale and Hush products appropriate for oncology patients, or are there some that are, some that aren't? Is that something that they teach you?
Yes, we actually have a list in our website and in the product knowledge classes that we give, telling you exactly which products you can use for cancer patients and pregnant women. That they are pretty much the same, but basically you don't use any actives. So you don't use vitamin C, you don't use any retinols, you don't use anything that is gonna be harsh on the skin. So the products that you don't use, because the list that you can use, there are quite a few, but the ones that you don't use are the vitamin C, anything that has the actives, and rare C serum, rare retinol serum, rare mandelic serum, the charcoal clarifying mask, the clear future toner. You don't use it because of the salicylic acid. Let me think which other one we don't use. I think those are pretty much the ones that you don't really use, or the ones that are, of course, no enzyme, no bedazzle, like no incredible enzyme, no bedazzle, revitalize. But for the rest, yes. And also the clarifying wash. That's the new one that we don't use it also.
And if you were to get a reaction from your client, how do you handle that?
If I have a reaction like gets super red or
like right then and there.
Normally, Hash Hydrate and Relief Bio Powder has been my way to go.
Okay.
Always. Like if they get super red, it's like, okay. Or if they get itchy, then that's my way to go. If they get a reaction because of something I put on, then I take a towel and I remove it and I wash it with a quiet wash.
Okay. I feel like every esthetician needs at least one like savior product to put if that happens. I have one and I'm like, oh, they're getting super red. Even after extractions, I'm like a little bit like they're very inflamed. I'm going to put this on it. What is it called again?
Hash Hydrate.
Hash Hydrate.
The Hash Hydrate gel or the Hash Hydrate mask. Both of them, they are the same product. Just gel will be for your client. Mask is for us in the back. But that when I give the welcome call or when I do my PK class, I always say, even if you don't buy anything from Hale and Hush, it's fine. But please do you a favor and buy the Hash Hydrate gel and the Relief Bio Powder. Those two are like amazing.
Like must-haves.
Yes, must-have.
Okay, perfect.
Yeah.
And then can you share a few go-to treatment protocols using Hale and Hush for oncology clients?
Sure. First and most importantly is the intake form. So after you see the intake form and you're clear to go, and sometimes you need to ask for doctor's permission. But if everything goes well, Then what I do, I always start with breathing exercise.
Mm.
Then after that, and like grounding myself and touching the client.
Mm-hmm.
Then after that, I do the quiet wash. I do it 2 times. We always use everything that is disposable with them, so that way, there is no contamination.
Mm-hmm.
Then I do the Miss Me or the Fresh Breeze spritz.
Mm-hmm.
Then I do a very, very light massage on the face. With them, you need to go very slow,
Okay.
like super slow when you do a face massage.
Mm-hmm.
You also need to know if they have lymph nodes removed, so you can modify the facial.
Okay.
But basically, you go super slow, you move, and not too much of effleurage, but just,
And why is that?
calming. Because then if they are having any reaction because of the chemo, too much, movement and effleurage, normally it's fast. But remember, you have to go very slow. So you don't want, to irritate the skin.
Okay.
That's the main reason why. Then after that, I normally remove the oil or the excess of oil, and I use the Remedy Rehab oil with a warm towel, not hot, but also not super cold.
Yeah.
So with a warm towel, then I do the Hush Hydrate mask with the Relief Bio powder, or the Berry Boost mask is another one that I like. And then I leave it for 10 minutes. I then use, if they are bald, I use my Remedy Rehab oil for the scalp massage. You see a lot of clients when they are losing their hair, they don't want to be touched in the scalp. The head is like, don't touch.
Because because they don't want more hair to fall out. Okay.
They are very afraid of losing more hair. So they just, I guess, you hold up to that, hope that you're not gonna lose all your hair. So they are like, no, just don't touch my hair. But then when they lose it, they get also reaction on the scalp. So with the Remedy Rehab oil, you can help to calm that irritation that they are going through. Then after that, what I do is I do a very light, shoulder massage, arms.
Relaxing.
If you can, if they have no lymph nodes removed.
Okay.
If not, then I do my Reiki. So, if they have lymph nodes removed, I just go a little bit with the Reiki or the alignment of the chakras. I always ask permission, of course. And then I remove the mask. I do again a Miss Me or a Fresh Breeze. And then I go with the Soothe Essence Serum. Then I go with the eye mousse. And then I go with the Vital Lipid Lotion. Or if they are still very red and, with that acne-like bumps that I told you, then I do, again, the Hush Hydrate with the Relief Bio powder.
Okay.
Then
Routine.
sunblock, of course.
Uh-huh.
And the Brilliant Eye and Lip Serum on their lips.
I feel like if you don't finish off with the lips, it's like
incomplete. It feels so weird because with men, it's like,
yeah,
lips.
I feel the same. I still do it though.
Yes.
Okay. I guess you talked a little bit about this. How can estheticians communicate sensitively and confidently when working with oncology clients? Like, is there anything that you feel like you shouldn't ask, you should ask? Yeah.
Always open questions.
Okay.
Because if you start like, are you okay? That is, it's not really going to be good. But how are you feeling today? Because remember, with them, it's one day at a time. So today they can be great. In a week, when you see them again, if you see them, then it's going to be probably something totally different. The fact that when you say, oh, yeah, I know. No, you don't. Maybe if you're going through the same thing, well, but you shouldn't say like, I know, because we don't really know what they're going through.
Exactly. Yeah.
If they say, what other question? There is one question that we always tend to say, or give like, advice. It's just like, no, sometimes silence is the best. For them, it's just the best.
Yeah, because they hear it all the time from everyone. You should do this, and I heard about this, and there's this
Exactly.
thing, this new, treatment that,
Yeah.
yeah.
We don't recommend anything. We are just there to listen. If they want to cry with you, you cry. If they want to laugh with you, you laugh. If they just want silence, you just don't say anything. And sometimes when it's a silence, it's unbelievable. But when it had happened quite a few times when I don't talk. When they come for the first time, I explain what I'm doing. But then when I finish, they start crying. And they say, like, thank you. It's amazing. I didn't do anything like over the top. It was just something to help them, their nervous system to calm and to be okay. And, just at least 45 minutes, that they can relax and they can think about something different and feel good.
Yeah, it's your presence alone, and just like, I feel like that's kind of why I became an esthetician, was because I love the feeling of being pampered. And then it does give you like a body awareness every time like you're touched in a specific place and stuff. It brings more awareness to your body, which a lot of us are so focused on the outside, right?
Yep.
Yeah.
For sure.
Okay, so then I guess I have two questions. You said that you obtained clientele working with the clinic, right?
Yes.
Is that how you suggest, if an esthetician wants to niche in oncology, do you suggest that they reach out to like clinics nearby, or is there like a specific way to market?
Okay. So if you're going to market in your place, because now I see that even cancer patients, they are going more to spas and to, to have a facial. If you're going to advertise it in your list, in your menu, just don't say cancer facial.
Yeah.
Or, anything like that. Just say something that it's a recovery treatment or, soothing facial, whatever it is. But don't put anything related with cancer. I'm not going to tell you it's an easy road because it is not. I started being, as I told you, a volunteer at Cleveland Clinic. Then I added to the American Cancer Society, and I was also a volunteer for them with the Look Good, Feel Better program. Even though sometimes, you feel that the ingredients there are not right, but you help them, in best possible way.
Yeah.
So being a volunteer there could also help you a lot. And it's just, yes, to the clinics will be the best thing. I know it's not easy. Sometimes it's not easy to get into the clinic. But social workers also help a lot. And nurses. If you can find a nurse that will also help you, that would be great.
So like they refer clients to
me.
Okay.
Yeah. When I started working at Cleveland, they didn't have my position. I mean, they didn't have an oncology trained esthetician. It was really me who made that position. And then I was hired, because before I was a volunteer, then I was hired. And when I left, they decided not to have it anymore. They wanted me to be there. And I said, I will train another esthetician if you want, but they didn't. But you get a connection with the doctors. And those doctors are the ones that are sending me clients now. They trust me. They trust what I'm doing. And they have seen the need. And the best thing is with the client or the patient, when they go back to them and they say, oh my God, I mean, I really needed that.
Yeah. Yeah, it also helps build trust between their relationship with their clients, because they feel like, obviously they're coming to them and complaining about their skin, and they're like, I have someone perfect for you, right?
Exactly.
Yeah.
You will find some doctors that they are still don't believe in you. Like no, they are very to the book, and maybe they don't, trust what you are doing. But you will find other ones, that are more integrative, that they will definitely, suggest you to.
Yeah.
Go.
I always tell estheticians, like, because a lot of estheticians outside of school will just go look on Indeed for jobs and stuff. And I always think, like, kind of what you said, like, create it for yourself, like, ask, just constantly just ask the right questions. If someone says no, okay, they can say yes later too.
Yeah.
Like I just reached out to a girl that reached out to me 3 months ago because now I'm like, oh, I need someone else, you know? So also you're planting the seed.
Yeah,
So that's
for
great.
sure, for sure. And it is, I was going to tell you something and I just forgot when we were talking about that and how to, for sure, you will have a client that has cancer. For sure. I mean, in one of your esthetician life, you will find somebody, okay? And if you treat that person right, that person is going to tell the rest of the people, because remember that most of them, not all of them, but most of them are in support groups. So if they know you help them, they're going to tell, you know, the friend, the other one that go to this esthetician, and that will definitely create, you know, trust
Yeah.
in the facial.
And then do you have any just like, if you can give one piece of advice to an aspiring esthetician that wants to work in this specific niche, or maybe to your past self, like what would you say?
Go for it.
Go for it.
They are the most loyal clients. They will follow you everywhere. It is super rewarding. Maybe you won't get rich, but for sure your heart will be full. That is for sure.
And that's rich.
And that is rich. That is being super rich.
Yeah. Well, thank you so much for sitting.
Of
We
course.
haven't done a podcast like this before. I feel like this is such an interesting topic, and it's really like beautiful. So thank you so much for like your service, the work that you do.
Thank you.
If any estheticians, I guess, are interested in following you specifically, do you teach any classes or do anything for estheticians?
We will be doing something next year.
Okay,
yes,
cool.
For sure. But I mean, if they have any questions, I'm more than open. I really feel that we need more oncology trained estheticians. We really do.
So where can our estheticians find you?
They can find me, well, Tatiana at haleandhush.com. I also have my Instagram account that is Wellness on Wheels. It's a little bit long. Wellness on Wheels _by_ Lilybell.
Okay.
I used to have a mobile, and I was going everywhere.
How
And
cool.
that was because of my cancer clients.
Yeah.
But now I'm growing, and I have a place in Orange. Yes, in Orange Drive. So that Wellness on Wheels by Lilybell.
And then if anyone's interested in bringing Hale and Hush, where would they go?
They can go to our webpage, haleandhush.com. They can also call the office. They can send me an email, and I will connect them. As I said, I also do the welcome calls. There are 45 minutes complimentary calls that we give any new esthetician or new to the line, I mean, and we tell them, everything what it's about Hale and Hush and why we are so good.
I love it. Well, thank you so much.
Thank you, Sam. Thank you so much.
Bye, Esties.
Bye.